Ready? I'm going to call the meeting to order of the Oklahoma County Handbook Committee. This is a special meeting, and notice of the meeting was properly posted November 21st, 2025. That said, item 1, discussion, possible action on the minutes of October 21st. Is there a motion to approve?
I have an item of discussion.
Okay.
On number 14 in the minute, because I've combed through these, I feel like pretty carefully, but maybe not. It's beginning with compensatory time, and then it's talking about the separate, will not collect pay for accrued sick leave. And I was like, is that what we said? Is sick leave somehow connected to this compensatory time? And I looked through my notes and I wasn't sure if there was a typo there or if that was what we had said. And if that is what we said, then that's great. I think I was confused, and now honestly it's been a while since I was trying to reconcile this with the draft of the thing that we had worked with. So I was like, if that's what we said, then that's fine. But I couldn't remember that those two things were connected. The compensatory time and the accrued sick leave. So just a question about number 14.
Yeah, I think you're right, Leanne. I don't think that should be there.
Yeah, I think there might be just a, I wasn't sure, but anyway. So, and I wasn't sure what the correction should be, but I just wasn't 100% sure that was all groovy there.
Okay, well, what I can do is we can just dispense with approving the minutes and we can have it at the next meeting. How does that sound?
That's fine.
And I'll check it and verify and review.
Okay.
Is that?
Yep.
Okay.
Is there a motion to defer this? No, what is it?
It'll just be to strike it or no
Okay,
action.
motion to strike, or do you want no action?
Whatever she said.
No action this week.
We'll say no action on it. We need to take a motion with Aaron's permission. This Aaron at our table, not the other Aaron in the room, to start with. We're going to skip over item 2 and take up item 3. So I need a motion to take up item 3. There's a motion. Is there a second? All in favor, please say aye.
Aye.
Motion carries. First, a word of explanation as to this version, and I'll try to be as brief as possible. I took it upon myself after our last meeting. There was discussion when it came to FML. John Wilkerson was here, and he said, I need all 8 pages. I think it was 8 pages. May have been a little bit longer, maybe a little bit shorter, but it took up out of our 45-page handbook 8 pages. So I went and talked to John, and I said, I will respect your wishes, whatever you want, but can you look at it, see if we can edit it down, or do you have an alternative? He sent me this, and he said this will fit. Is there 4? And without objection, I would like to be working with this part of the minute. So I took that and basically it's a PDF on the Federal Department of Labor website. I took that, copy and pasted it, put it into Word. I sent it over to our English professor, Leanne, and she cleaned up the third person language and put it in the second person. Is that correct?
Other way around. Cleaned up the second person.
language. This is why I failed in English at the university. So we cleaned it up, and I took that and put together the wording up there of the complete 2025 county handbook. So it is my, not against anybody's will or something. This is my version of a clean version of the handbook. There is still some red stuff that we need to pay attention to. Erin has some good items that she wants to go over. But with John, I remember Lisa saying, and please correct me if I'm wrong, if we just had reference for more information about FMLA, you can click here. So as a compromise, I took this and it saved us about 5 pages with cleanup language from third person into second person. So that said, I do not want to disregard the wishes of this committee. That is the Rick Buchanan version of FMLA. And if you guys disagree with it, I believe with great vigor in the consensus of this group and the collective brain power. So,
Can I just add also, he's saying that this obviously looks different. I had a little bit of spare time on one day. It's been a while ago now. And just fiddled around with trying to make headings and, that kind of stuff more consistent. The blue I simply picked. It's just one of those styles in MS Word that I just chose one kind of randomly. I picked the blue because it kind of went with Erin's beautiful cover that she designed. But again, there's nothing sacred about any of that. It's not, I just tried to sort of make it a little more uniform. So that's been added to his version, if you will. But again, if people don't like it or they don't do that, it certainly doesn't hurt my feelings. It's fine. That's why things are blue and look a little different, because I simply had a little spare time. It was when I was going through and working on the hyperlinks that something about that. I was like, these headings, there's just so many different kinds of random headings. What if these were all consistent? And so I was kind of working on hyperlinks, and as I went through, I just sort of did that. But like I said, Rick didn't ask for that. I just did that sort of randomly one day because I guess it was just bugging me. So, but nothing sacred there. If anybody doesn't like it or wants it to be different, no problem.
I had an old boss guy named Frank Keating, who was governor. He used to say, "I'm only married to my wife." I want to make that clear that you all, the collective wisdom of this group is most important to me. This is not about anything. I'm not anybody special to think that I've come up with some magic pill. But I thought of it as a compromise for that section in our handbook. What is also, if you notice for the detailed folks, I did not put a table of contents. I hate wasting paper. Those people that just don't like doing that. And so I did not put a table of contents in there. My thinking is, once we get a final version that we send to Lisa, the table of contents doesn't matter, because she will guide us via our magnetic north when it comes to a version that can be taken up to before the budget. So that said, I want to leave that all on the table. We have special guests this morning. So let all that stuff percolate. And we have Aaron Etherington here with us from the Jail Trust, and a couple of very special people who will have a presentation under item 3 that I believe will do with the definition of full-time employment. Is that correct?
Yes, that is correct. Thank you for allowing me to come today. You're probably wondering why I'm here. The Jail Trust is obviously a separate legal entity, and so you are right to ask, why are you here? To ask us to make changes to our employee handbook, and that's a fair question. And I'm here to show you why. This is an addendum to your, to your county retirement plan. And you will notice there, towards the top of the page in item 2, that full-time employees of the Oklahoma County Criminal Justice Authority are defined by the definition that is contained in the Oklahoma County Handbook. So that is why I am here to address the Handbook Committee. Most of you all are probably aware that about a year and a half ago, just under a year and a half ago, medical went in-house at the jail after our outside medical service provider terminated their contract with us. And so we've been operating in-house since that time. Now, you may also be aware that the Criminal Justice Authority has put out a bid for outside medical services. I anticipate that will be on the January agenda for the authority to consider whether or not to select an outside vendor. The bids that we received, I can tell you just ballpark, don't quote me on this. At the low end of the range was $11 million. The high end of the range was over $20 million. So that's pretty pricey. That's obviously money that we don't have. But we do have a staffing problem within our medical division, and it is tied to the definition of full-time employee that's contained in the county handbook. In the county handbook, you have 2 definitions for full-time employee. One for your standard employee that is 40 hours a week in a 7 consecutive day period. You also have a law enforcement definition that is for, I'm sure Brandon can correct me, it's like 171 hours in a 28-day period, some ballpark like that. The problem is medical providers don't fall within that law enforcement definition under the FLSA, even though they're working at the jail. And in private industry, medical staff typically don't work 40 hours in a 7 consecutive day period. And I brought with me our HSA and our director of nursing, who obviously have come from private medical practice and can answer any in-depth questions in that regard. But typically, what our nurses are used to in private world is 12-hour shifts for 36 hours per week. And so while when we're recruiting nursing staff, the benefits are very attractive to them because obviously county benefits are far superior to anything anywhere else. Really, I'm fairly certain of that. Definitely, what is available to them in private medical field. So while we can get them sometimes in the door, it's difficult for us to retain them because we're having to fight against the norms, the national norms for medical scheduling of non-exempt nurses with this 40-hour a work week definition that's contained in the handbook. So what I am here to ask the handbook committee to approve as a recommendation to present to the budget board is the language that I have circulated. Medical personnel who are scheduled for 12-hour shifts with an average of 36 hours per week are considered full-time employees for purposes of health and retirement benefits. If accepting this change will help us to not only recruit but to retain. As it stands now, because we're having difficulty keeping medical staff who just can't make the adjustment to the 40-hour, 7 consecutive day work week, we're having to rely upon temporary staffing services, which pay at a higher rate. So it's costing us more money to use the temp services than it would be to obviously be able to recruit and pay and offer the excellent benefits that the county has.
How are they scheduled then, if they're not 12-hour shifts that add up to 36 hours? How do you all schedule them?
Well, I'll Sarah, is that a question for you?
Yeah, absolutely. So because of having to work with that 40-hour work week, we are doing 36 hours, 48 hours, 36 hours, 48 hours in a 4-week period. With that being said, we're paying lots of overtime with people having to do overtime. It's a forced overtime for people, but they're still not qualifying because of that 40-hour work week. So we're doing the best we can to make accommodations with what the handbook has, but it's forcing overtime on people in addition with having to pay overtime, in addition to having to pay more for a contracting agency to come in.
And as far as you know, Miss Etherington, there's nothing federally that I'm aware of that says in order to qualify for retirement or employee benefits, it requires 40 hours a week. It's acceptable in other parts of the state and country, excuse me. It could be 30 hours or
I
whatever.
am so glad.
It's local. It's like a local rule.
It is like a local rule. And I want to be clear that this will change the definition of full-time employee and impact, our scheduling, our eligibility for retirement benefits. It doesn't really change how overtime is calculated. But more to your point, those counties who do not have their own retirement system are allowed to participate in the state's OPERS retirement program. And the handout that I just circulated actually defines full-time employment for county employees who are in counties that participate in OPERS as requiring at least 1,000 hours of work per year. That is significantly less than what we're asking for at the 36 hours per week, and certainly significantly less than what the existing handbook requires at 40 hours per week.
it would be a couple of questions for me, and I expect others to chime in. Every year when we do the budget, and this year I believe BET, on which I serve, Brandon's on it, Paul's on it, Ryan sits in here an alternate. I mean, right? Brian's here sometimes, Joe's here, Cody, chair of BET. When we did the 3.2, either left up to each elected official to siphon or however they feel appropriate, or they could accept it or not. I believe the county clerk's office did not. The jail's not included. Jail staff wasn't included in it. So, is this, when we look at this, I assume the jail is under a quasi contract with the county, right, to the jail trust? Is that how we're looking at this? Or are
No.
they considered part of the county family?
They are a separate legal entity.
Right?
So they are not, it is not contractual. The trust indenture is what created them as a separate entity. So that's not a contract, that they're not part of the county family in that regard. If they are part of the county, it is by virtue of the retirement plan document, which also allows other non-county employees to participate in the retirement plan. And that's the limited application of the request that I'm here making, is for the retirement benefits.
How does the, sorry, did you have a
Feel
follow-up
free.
question? How does the retirement plan document define full-time or eligibility?
It doesn't. It refers back to the handbook, which is why I provided you with that first copy.
Do we know, and it'd be impossible for anybody here to know this, but our contract with BOK, who oversees the administration, do they have a federal requirement? I think Investors may have, to say full-time employment is 40 hours.
I mean, you're going to have
Check
to,
on that.
I'm not aware of any. In fact, if you'll notice by your own retirement plan definition, for public defenders, it's just whoever the PD designates as full-time. There's not even any sort of limitation with regard to that. So I don't see that as being an issue.
Do you have some proposed language you want us to retirement? Handbook?
Yes, and that's what I've passed around, the medical personnel definition. And we would need it to be this exact language because we've crafted it this way to where it does not encompass all of our medical personnel. Specifically, we're really targeting our non-exempt nursing staff because those are the ones who work the 12-hour shifts. We have other medical staff, like med passers, some
Providers.
other mental health providers, thank you, who don't come from a private practice that has this sort of national standard in scheduling and do not have any problems with the 40-hour work week.
Would it have, Aaron, where did you do this? Would it have, this would set some type of precedent of an effect on all 8 other offices in definitions that each elected official sets up part-time labor.
Well,
Well, it's not part-time.
it's not part-time, it's
Anything over 30 hours.
thank you. And it would be limited to medical too. Yes,
On your language.
yes.
So on your language where we have in the plan document, it says employees.
Yes.
That's maybe to address, I think, where Rick might be going, can we just include that, your proposed language?
In the plan,
Well, where it specifies that we're talking about employees of the trust.
I don't think that language should be included in the plan. I think this language should only be included in the handbook. I would like to, I mean, this isn't the body to do it in front of, but I would urge the county to amend the plan document as well. And I would suggest going with language that mirrors the language that's in there for the public defender's office. That is very simple, uncomplicated. It's just full-time as designated by the entity.
Then the second part, did you address, so working average is 36 hours,
Correct.
but overtime, did you address, is it still based on the 40 hours?
Yes.
So they get 4 hours?
Yes,
Hour per hour?
yes.
Yeah, I think there's we find this sometimes in law enforcement, actually, probably next month, I might even bring some language to potentially change how law enforcement is looked at for full-time as well. But I think some people get confused on the difference between full-time and the point at which overtime is calculated.
Yes.
And so, just because the way that I understand full-time is that it's a collection period between sometime like from January through October. And as long as you work on average over 30 hours during that time, you're considered a full-time employee and eligible for benefits. But the 40 hours is really only the trigger point to where overtime is calculated. It doesn't mean you're a full-time employee. So as far as I know, we can give benefits as long as that person works 30 hours or more per week on average. That's at least the way I understand it.
And I agree with that statement.
And somebody could work 40 hours a week and not be full-time? Is that what you're saying?
No, I don't think so. Because I think and I think there's some other things, especially as it relates to like the health plan and stuff. I think there's some other weird trigger points too that I'm not immediately familiar with. But like for example, if you have a certain amount of employees in your organization, like 50, I think is the set number. If you have I think you're required to like give them health benefits and a few other things, but none of that don't necessarily directly apply here. I don't think there would be a case where. Well, I mean, I guess technically, there's no. I don't know. I
I just thought, I wasn't sure what you had just said.
Yeah, I don't know that we don't have a full-time employee that we work. We don't have a part-time employee that we work 40 hours. If that's what you're asking.
Yeah. I just didn't know that was possible, but okay.
Yeah, I think this is just kind of a different classification of employee. I don't necessarily see an issue with adding it in there. My question would be, I don't know if this is where Rick was headed or not, but when the BET gave the budget to the jail, it was in the form of a contract at the time. So do you know if this change would be made here? Was maybe not the venue, but do you have the money to put the 12% in on the backside if they went into the retirement plan?
Yes.
Okay.
We're already putting that 12% in. Because what we're trying to put the square peg in the round hole at the 40 hours.
Okay. So our medical personnel already on the retirement plan with the county?
Yes.
They are, okay, so then nothing's changing.
Yes. We just want to be able to deviate their work schedule to make it more attractive for them to stay here because it's what they're accustomed to in private practice and keep that retirement and health benefits.
Okay.
That's really all this is about.
And this is kind of maybe a question off the table, or maybe you, because I'm sure you were involved in it at some point. What do we do with our county pharmacy? Do they qualify like under the same like scheduling like the nurses might or other medical staff?
I guess I'm not understanding your question.
Well,
it's a health. We actually, they would qualify for the health benefits because you're actually defining your health benefits different than you're defining your retirement benefits. Because your health benefits you qualify for at 30 hours.
Yeah.
So that's not an issue.
Yeah.
So they're absolutely qualify for that. That won't change.
Yeah, I guess what I meant is, so whenever social services went away, we put our own county
Right.
policy in place. Do we consider those medical staff that would be accustomed to working that 36 hours per week, you know?
I don't know, if maybe if they work 12-hour shifts, I don't know how they are scheduled.
Because as far as I know, they're Paul or whoever, I mean, because as far as I know, they're county employees, right? The county pharmacist is now a county employee. So, I mean, they may fall under something similar as well. I don't know.
Like juvenile detention has nursing staff.
I don't think pharmacists work 12-hour shifts. I think they go crazy if they work 12-hour shifts. For 12 hours. I don't know.
I have a few more questions. Anybody else? Okay. Is there, if medical, if I understood correctly, you guys are getting overtime for those 48-hour weeks?
Yes.
Okay. Please don't feel like I'm insulting anyone. Is there any compromise to say you guys go on 4 10-hour shifts and do 40 hours a week?
That's not the national standard. That's the problem. Anything that, I mean, we're trying to mirror the national standard in scheduling. And that's not unique to Oklahoma County. That's not unique to Oklahoma. That's just the way.
You're talking about jail medical.
No, I'm talking about private medical. That is the national standard. And so for those nurses to come on over,
Right.
At perhaps even a lower pay rate because they're so attracted to the county benefits, we need to make sure that we can mirror the scheduling that is done in private practice.
Gotcha. I get that.
Aren't they scheduled 24 hours a day?
I mean, we're staffed 24 hours a day. They're not scheduled 24 hours a day.
So
Right,
let
but
me
you
put
have-
it here, and I'm gonna answer that question. So I'm gonna go back to your question as well. So the reason 10-hour shifts don't work, is because you need continuity of care. If you look at multiple research studies, I mean multiple research studies.
Can I get you up to the podium?
Oh, okay. If you look at multiple research studies, that continuity of care is extremely, extremely important, especially when we're working with patients and in the healthcare setting. So that's why we do the 12-hour shifts, so that you can have nurses that work in one or multiple different areas, and then you have that continuity of care. It reduces risks, it reduces medication errors, and if you do even just a quick Google assessment, you can pull up multiple research studies that have solidified this fact. So that's why we do 12-hour shifts. The only people who do not do 12-hour shifts are providers. We do have providers that do 10-hour shifts. We have LPCs and mental health counselors that do 8 to 10-hour shifts. But other than that, all our nurses are doing 12-hour shifts. So it is primarily for that continuity of care.
And
We
so-
are staffed for a 24-hour period. We are required per the standards, state standards, to be able to offer 24-hour medical care. And so they are scheduled for 12 hours.
Okay, I have a question for our attorney. Lisa. We serve at the pleasure of both. We're being requested by the jail to make a recommendation to the budget board. Do we have the leeway to do that if voted on today, or do we need to wait for the budget board to direct?
No, right now what you have, even though it's a jail and it's a jail trust, statutorily, there's a provision that says jail trust employees can participate in the county retirement plans. The VOC, that is happening already, that is already occurring, correct, Darren? They're already in members. What you have here is you have a group of people who are already receiving county benefits, health benefits, are already employees for the purposes of their pay and their retirement, county employees. What you have is a group of people that are falling in a gap. The national their shift differential, they don't qualify as a detention officer, under FLSA, so we can't treat them like a detention officer, which is what we would like to do, but the FLSA tells us we can't. And they also don't qualify for the shift differential that they want as hospital workers because the jail's primary function isn't as a hospital. So what you have is you have a group of employees that are being paid by the county that are going to be governed by this. Now, I understand they're a separate entity. They have all but adopted the county handbook to keep, this continuity that we are speaking of and expectations. So I think that you're all right in recommending it. In fact, I think that this is a very important issue that probably needs to be addressed because right now you've got individuals that are being told they're working 36 hours and they're full time and they're doing a job that we have a very difficult time filling at the jail. And then we're telling them, you don't qualify for retirement benefits. And so we either risk losing and not funding the hospital or we address it. But it would be a very specific niche and I don't think it would set a precedent for any other elected officials because they don't hire and employ medical staff. So if you have it for medical staff, and remember Oklahoma County is we're building a behavioral health center. That is probably going to be a hospital trust. There may be in the future additional. Whether you take care of it now, at some point when that behavioral health center is open, you're going to probably have this question as well.
I would follow up.
Well, it is, but we haven't created a hospital trust yet, and I don't know how that's going to look. But depending on how that is operated.
Unless I'm missing something, I don't see the problem. Even if it does have a precedent, who cares? I mean, if an employee gets paid $1,000 a month and they work 10 hours to get there, or they work 40 hours to get there, they're still putting 12% on the backside. So I don't see how it affects us at all. And that's coming from somebody who's a elected member of the retirement board. I don't understand. I don't see the issue at all personally.
And the OPERS definition that Aaron mentions is very important. County employees across, when the counties were offered statutorily the opportunity to participate in the state employment program, the OPERS program, you either did that or you did your own county benefit plan, which is what Oklahoma County did. All the other counties and most of the little counties did the OPERS. Their folks are getting retirement benefits according to that definition in the state statute, and the state statute gives them retirement benefits at 1,000 over 1,000 hours worked, which is less than the 30, which is less than the 36.
But even in that case, even the amount of hours, because I'm familiar with OPERS as well, it's still a direct reflection of how much money the employer puts in based on a percentage. Unless I'm just missing something glaring, I don't see a problem at all.
And this might not be a fair question to Lisa, so I apologize if it's not. But, in terms of the precedent, you mentioned the county pharmacy. I'm not the employment law expert, but I suspect that perhaps pharmacists are exempt employees.
Yes.
By virtue of their
education.
So this is the nursing staff who are non-exempt. Like we're talking about a very narrow sliver of non-exempt employees.
Well, we've got a class of employees that, as far as the precedent, what you're talking about, they fall into a gap that is not covered. I think if in the future, as I sit here right now, I don't know of any other employee that falls into a gap like that. But if we do have a group of employees that fall into a gap now or in the future, I would think that we'd want to take care of those situations just like this. So this may set a precedent, but it would be a positive precedent to make sure that nobody falls into a gap like this.
And that you don't have a plan that, as I've said, with this whole handbook and the ad code, I call it the protection of the herd, but we have other counties out there with county employees getting retirement benefits. But here you have to work 40 hours to get the retirement benefits. In other counties, it's lower than that. when you're going to compete for employees, even other employees from other counties, they're gonna come and they're gonna see that and they're gonna go, why would I wanna come to Oklahoma County? I can work, 36 hours and still require,
Yeah, but you can work 36 hours and get an inferior
Right.
retirement plan versus working 40 hours.
right, I get it, but I'm just saying there's safety in numbers and of the fact, I don't know that the legislature actually intended for the counties adopting their own retirement plan to give less than what the state workers are getting. And to me, right now, that's what you're doing when you have a retirement plan that says you're not entitled to be a participant in retirement unless you work 40 hours.
I disagree with that. Lisa,
You can
because-
just agree with it all you want. He asked for my opinion. He got the lawyer's opinion that works for the county.
Okay.
Thank you.
Okay, well, that's the lawyer that works for another part of the county. I think that
Some days.
some days,
Yeah, put some of your stuff on me.
okay. I thought statute. Never mind.
Aaron, you stated that the public defender statement
Yes.
right here is very clean and simple.
Yes.
Is there any advantage to using that same for the criminal justice and just stating it?
I
that
would
way?
love that. I would love that.
Would
And
it accomplish what you're trying to have it do here, or would it not?
well, I think,
You understand
I
my
think,
question, though,
I do
right?
understand your question. I love it for the plan. Let me be clear. I love it for the plan because your plan shouldn't be drilled down into
Right.
the microscope.
Right.
It needs to be as broad as you can define it for obvious reasons. So I do think for the plan, that should be amended. And if the plan spoke that way, we wouldn't even need to amend the handbook. But because of the way our plan is, it's much easier for me to come to you as the handbook committee, urge this change, and we can fix it on the back end and a slower process of amending the plan.
So you just want us to change, well, where we have what qualifies as a full-time employee, that definition, you want us to add this,
Please.
or, yeah.
Add that language. Add that language. I'm really not even asking you to change your handbook. Just add this little sliver.
Where would that go in the handbook?
But it's the current
It's not.
I'm looking at the employment status definitions, full-time, part-time, temporary. And right now, full-time says an individual who is regularly scheduled to work 40 hours or more per week is considered a full-time employee. Full-time employees are eligible for benefits.
Why don't we change that to a non-medical employee? It's 40 hours, and then we can add that medical personnel or 36.
But you would be asking for this to go in the interim handbook, not this draft that
Correct.
doesn't work.
Correct.
Yes.
Which I believe, and I don't have it in front of me, I believe it might be 6.1, is where you define your differing hours of working for purposes of health and retirement benefits.
Oh, I wasn't even thinking about that. You want that done now,
Yes,
not
please.
for the
Yes.
thing that we're working on.
Yes. Yeah, this to us is very urgent.
Gotcha.
I don't want to rush your deliberative process for your new version.
Non-exempt medical. Because she doesn't.
So we don't have an
agenda item on right now to amend the current and the interim. The only thing we can do right now with the current agenda is to put this in the working right now, right? So we'd have to come back with another agenda item next time, put it in. Do I have that right?
Yeah, I think that makes sense.
This was an agenda item for discussion of possible changes.
Yeah, there's possible action.
Or the draft, the new
You're
draft.
right, you're right, the new draft, you're right.
Would it be possible for us to request a special meeting?
You could do one for Wednesday afternoon, and then just put a preemptive agenda item on budget board for Thursday before you have this special meeting on Wednesday.
Everybody look at your schedules for Wednesday afternoon.
I have to see if we have
Day after
coverage
tomorrow,
and then. Wednesday? What was that what we tried?
Yes, day after tomorrow.
Okay.
There's no item in this old mess that we can add this into the current handbook.
Have to be early afternoon for me.
We're working on a new draft.
That may be something as you're working on this draft, get a recurring item that allows you to make changes to the interim
Good suggestion.
as you move forward.
Do medical employees have a specific place in federal standards, or they just follow the same?
They have one for entities that are predominantly in the business of caring for the sick. I mean, the definition
Yeah.
is really designed to capture hospitals, residential care facilities, that sort of thing, not jails.
Right.
So, I mean, we are in just a gap.
Well, the reason I was thinking is that thinking in the future, if we can make the language more simple, just in general, it says for the FLSA classified, that would include law enforcement, regular full-time employees, because obviously with the changes that the jails and the new jail is gonna have, there's gonna probably be some unique employees in there that will be hired to, accommodate some of the new things that are coming.
And that would hurt us because that would make us default back to the 40 hours.
Okay.
Because we're not predominantly in the healthcare business.
Okay. I got you.
How's it looking, Kathy?
I can't give an answer right this minute.
Okay,
I have a text out to see.
all right. Well, we have to wait and see if we can get it special.
You'd like it.
Yes, please. Because, notice how you've got your 30 hours for health, and you've got your 40 hours, and then you've got your 171 and 28 for your law enforcement. We need some medical. We need our medical in there.
While we're waiting, I'm gonna suggest I would entertain a motion for a 10-minute recess, returning at 11 o'clock in this room. And everybody grab a donut. And we'll wait and see if the clerks of the board are available. And you all check your schedules to see if you're available, okay? So I'll entertain a motion for a 10-minute break.
So maybe second.
All in favor, please say aye.
Aye.
Motion carries. Ian 10, get a donut. All right, it's 11:01. I'll call the meeting back to order. Is there a motion? Second. All in favor, say aye. Motion carries. Thank you very much. Without objection, these three documents that were passed out by Aaron, or is it two? Four. All right.
Three.
Yeah.
Probably.
All right. Three documents that the chairman would like to make it part of the record. Anybody object to that? It'll be part of the record. All right. None of us expected a meeting like this morning, but it does sound like there's a sense of urgency. I need to ask our legal counsel, is there anything on our agenda that would save us from having a special meeting Wednesday afternoon?
Sure, if we vote to add this to the current draft version, that would then free up Ms. Everington to be able to go directly to budget board and ask for that to become part of the record. You've already voted on it, you've already passed the language, so just let her go take it for the sense of urgency. We won't have to come back.
So, under what agenda item would that be?
Number 3, where it says, and of course, number 3 it's kind of a broad one, but because it's so broad, it says to add, including any potential revisions or changes to your clean draft. It would be accepting that amendment to the clean version and passing.
Yeah, it would be adding it to the current version, but surely if everybody votes for it to be added to the new handbook, they also vote for it to be in the interim handbook. So. But I've seen Stranger Things.
Would that have to wait until the next meeting for it to officially go into the
I think that
interim?
you're voting on this language to add it to the new handbook. I think that is the type of approval that says you would include, if there was an agenda item, you would include.
You can't make a recommendation to budget board to adopt this new language into the interim handbook. There's not an agenda item, is my understanding. But by you guys weighing the agenda language and saying our final, whenever the final one is done, we'll have this new language in there. You guys have all discussed it, then any of the elected officials can put an agenda item on budget board. It won't have a recommendation from this group. It'll just be an agenda item to add this language to the interim handbook. And budget board can take that action without a recommendation from this group. But each of you can go back and talk to your elected official and let them know that there's going to be an agenda item on that will change the handbook immediately on Thursday to allow them to be able to make the change that you're going to have in your ultimate handbook that you recommend. Does that make sense?
Yeah.
Okay.
I'll make a motion that we have the language that was provided to us. If I need to read this out, I need to read this out. Second.
She already read it.
Yeah, I'd make a motion to page 9 under employee classifications. I guess I shouldn't put page 9, but under employment classifications, so we can specifically identify medical personnel
In the
new
Your employment status definitions.
okay. And is there a second? And then I'll ask for comments.
I'll second.
Do we need to say specifically, or is that good enough? I mean, do we need to, we're just adding that sentence to the sentence that's already there
That's what you need, right?
for full-time employee?
Well, let me ask this, are we adopting this new version? Because I think we're getting a little ahead without having a conversation about the changes from the draft that we've been working off of to this new draft that you're presenting.
No, all you're doing is saying that this language that changes
But if
the
you're adding it on page
definition.
9 to this document,
Well, that's what
that's
he's-
not even the document that we've done.
But that's what he said, never mind, on page 9, should be added under this section.
Yeah, under the full-time eligibility section.
Okay.
Whatever that title is, whatever page that's on.
We're just adding it to that the proposed. We still have
Probably towards the beginning.
Aaron.
Yeah.
We're still
A
gonna
little bit more right there.
gnash
Yeah,
teeth
that's-
over this.
So I think, I think I also had some confusion
Okay.
in what was happening. Because in the one that you all have been working off of, the section header says employment classifications, whereas the new one that's attached has a different header title, which I don't know, I don't believe that that's been voted on to be changed, but it says employment status definitions.
Right now, I feel like we've got about 347 times 10 to the 8th power number of handbooks.
Yes.
So whatever the final document is, that's where I want that to go.
Okay, I think
So-
its current name
Okay.
is employment classifications. I could be, but feel free
Yeah,
to.
we haven't adopted this proposed
Right,
draft at all.
right.
Like I said, I'm only married to my wife.
So just say that it's going under the definition of full-time employee regardless of what other headings are up there? Is that what we're trying to say?
Yeah, so whenever we're looking for this current, so when it says, just got, like, let's say item number 4, where it says section of the handbook draft, which version are we talking about? Aaron, do you know that? Let's just say on item 4, you say you want to put balance for appropriate conduct of the handbook draft. Which version of that handbook are we talking
I'm
about?
still working off of the ACO handbook that we were originally given, which is not the same as this. And my concern with this is it doesn't track what's different, so you can't really tell looking side by side. I appreciate it being brief, but I don't know that we can just agree to leave out all of the FMLA definitions, or not definitions, but sections that are in the ACO handbook. I think that needs a lot more discussion, and then there are just a lot of changes to this. Some that we voted on that are not reflected in this, some that we haven't addressed yet that have just been applied to this book, so I'm not comfortable working on this draft.
My whole goal, and I think, is just to figure out, so we can have a legal discussion around the table about this language. And if so, if we come to an agreement or not, it would give us the ability to make a change in the current interim handbook.
I hate to throw another wrench into it, but
We'd like to
item three is the only item that we can vote on this on.
Okay.
And item 3 only would allow us, I believe, to add it into this version of it.
Perfect.
Not
Which is
And-
not final.
And that's perfectly
By
fine with
any
me.
stretch of the imagination. So it's a recommendation that we want to put into a draft that's going to be edited, no doubt, for future handbook. Correct.
I have a suggestion on language that I think will get you there. You can go to the section of the clean version, adopt this language with the intent that this is the only language in the clean version that we are adopting to be in both versions of the handbook. Both drafts. Okay, because it is the only section under 3 that it can fit, because of the way everything else is written. But you can piecemeal it, which is what you've been doing throughout this entire time, is taking section by section. So you could go to this section of the clean and adopt that section of the clean as the provision that you want in the final handbook, regardless of which version.
Hey, Aaron, to alleviate your concern, because I understand where you're going. I don't think the budget board, this group doesn't have to make a recommendation even into the final document at this point. But if everybody's comfortable with the language that Ms. Etherington has provided, and everybody wants that classification of employees to be covered under benefits, all that really would have to happen from this meeting is, I mean, you don't have to technically take any action. You can go back to your boss and say, hey, budget board on Thursday, there's gonna be an agenda item. There's not a recommendation. We all discussed the language, but due to the way the agenda items were structured, we couldn't make a recommendation at this point. but this language is going to be in our final document that we get to you at some point. But the jail needs this now. So I'm just letting you know what the agenda language is gonna be on budget board, what the intent is, and that everybody around the table is comfortable with that language being in there. And it will be a part of the final recommendation at some point, but they need it added into the interim document immediately.
Yeah, I understand, and
And then you
what
would
it
have
comes
to
down
have-
to is a budget board decision, not this group. So,
Right,
like
but
we
you're
said, we're
not
not
making,
making a recommendation.
you're not determining which document you're putting it in at this point.
Yeah, I just don't, like, it's not, it should be on the agenda if we're gonna vote on it, so I'm just a no, but, if we wanna move forward, then it will be on budget board, it's a budget board decision, so. I understand what you're saying too.
And all I'm recommending is that you can vote on this new clean version. Any provision, you can vote on it, that's what this is. It's not to adopt the entire version, you can vote
Right.
piecemeal on item 3. That's my point.
You're good with that?
Okay, so just to confirm, your motion is to add the proposed language of the OCDC to the county handbook in section employment status definitions under compensation policies.
I mean, I think,
No, they're voting to add it to this clean, whatever, 2025 county handbook, November 21 clean version. Is that what it's called in this?
Yes, I just briefed up county handbook. Sorry,
Okay, yes.
I do have it correctly though.
Okay.
Okay.
That was your motion, right?
So this right here is what we're gonna add it to.
Okay.
but again, that may not be the final definition, I just wanted to switch. We can, because if people wanna make a change on that language for some subsequent version down the road, I just wanted to be able to talk, the way to talk about it. This is the items that do that on the agenda.
Did we have
So,
a second?
Yes.
I'm sorry. So,
We're discussing something. Let me, Leanne, just one second. Is there a second so we can?
That's right.
Yes.
That was Ryan. Okay, Leanne, go ahead, please.
I just wanna make sure I understand. I don't like this job of being the one who writes this all out, but that's okay. And it's gonna say, an individual who is regularly scheduled to work 40 hours or more per week is considered a full-time employee. Then medical personnel who are scheduled for 12-hour shifts with an average of 36 hours, and then, well, full-time employees are eligible for benefits, and then this sentence is gonna be immediately after that? Is that what we're saying? I just wanna make sure when I go to write this in.
Just to get to the budget.
This sentence is gonna follow those two sentences under full-time employee. Is that what we're saying? Just wanna make sure I'm. Because-
I mean, does that get you where you need to be? Yes.
Okay, just making sure I was
Okay.
tracking. Okay, sorry.
And I want to make sure that we know that this is a very narrowly focused item. We've been trying to do broad things. This is very narrowly focused. It's intended for medical personnel at the Oklahoma County Detention Center. Judy's under contract with the medical personnel.
For Oklahoma County employees. So it does affect all employees.
Their medical personnel are considered county personnel at Judy.
Yes.
Yeah.
Well, yes and no. They have contracts for
Right.
certain provision of services over
Right.
there as well.
Like the doctors on contract,
Right.
but the nursing staff are employees.
Yeah. So does this affect them?
No, I mean, again, just because, at least, I mean, yeah, the language could affect it, but, I mean,
It gives them the flexibility.
Yeah, sure.
40 hours.
and I can hire for 36 or 40.
It might solve a problem.
It doesn't require,
It
doesn't
does not
require.
require them to make any changes to their existing schedule,
And as
but
far
it gives
as,
them flexibility to do so.
insofar as we're looking at this is specific to the Oklahoma County.
And I wouldn't make it specific just because, again, there could be some possibilities, but I think that if we just make the language but she provided. I think it's still.
If they're scheduled for 12-hour shifts.
Yeah.
Which this is not specific to the. Yeah, this is just for you, for clerk to hire
Yeah,
under this, and they would be eligible.
you could hire your own nurse if you want, yeah. And even with the
Mother-in-law's in
well, and even if you did hire a nurse at the court clerk's office, you could still have them work 8 hours a day, 5 days a week. It doesn't require that you do that. It just provides that as a
Just
possibility.
making sure we all understand what's going on and that anybody watching this or listening or reads the minutes knows what's going on. Okay, we have a motion and a second. There's been discussion. Is there any additional discussion? Let's do a roll call vote.
Paul Foster,
All right.
Leanne Hines,
Aye.
Ryan Jasper,
Aye.
Brendan Holmes,
Aye.
Aaron McConnell,
Nay.
Stacy Rogers,
Aye.
Rick Buchanan.
Motion carries. 6-1.
Yes.
Thank you. Thanks for joining us, Aaron.
Thank you for allowing us to crash
Yeah.
the party.
Thanks for ruining my 1 hour rule.
I apologize. But that's just more time for you to eat this up.
I did. We got one. Thank you.
Would anyone be open to the idea of taking a recess and picking another time? We've been through some heavy stuff, or do you guys want to push on?
Let's go. But not a big.
Oh, it is just about lunchtime. Anybody need lunch? You want to keep on pushing?
Go.
Okay. Just asking. Trying to be the brought donuts. Trying to help you. All right. Let's, Aaron, let's go to item 2. And when you're making changes, as I understand it, you're referring to the draft we've been working with in the past. Not the-
That's correct.
Okay. Let's go to item 2, Aaron.
Okay, so item 2 picks up what we left off last time, and John Wilkerson was in here talking to us about what he needed in the handbook with regard to the county's payment of employer share health insurance premium and leave of absence. So that applies to FMLA, workers' comp, and there's one other area. So in this draft, where you'll see what I'm proposing is under the absent without leave available. So I guess this is just a standard absence approved by a department. So this is on page 16 of this draft. And this takes the language from 4.13 page 16.
This is got your.
Is Cassie on the right page here?
Page 36.
Oh, that's so I would remove this section in place, sorry, and put these new sections into different areas. But up from the
16.
so what John explained is we're working with 3 different categories of leave of absence, and depending on the status of or the reason why you're on a leave of absence, the counties covering the health insurance would be different. So this takes just the standard leave of absence and puts it into absent without leave available in leave benefits section. So this language is from the interim handbook 4.13.
Would you please explain what is new?
What's new?
Yeah.
This is from the current handbook. So what's tracked in red,
Right.
that is just taking the process from the current handbook and putting it into this handbook. So if you remember that section that I had taken out, can you go back to 36? What John was basically saying is it oversimplifies it, and he wanted to keep in what was currently in the handbook. So this was trying to lump in leave, workers' comp, and just the standard leave of absence all into here for coverage of health insurance premiums. So he was wanting more detail from the current book to be transferred over, and that's what this is for standard leave of absence on page 16. And then on page 19, workers' comp, and then it's already covered under the current FMLA section. Well, I said the current in this draft.
Okay. So you're removing this from page 36.
So removing the section on page 36 to put in the detail that's in the interim handbook, what's currently in use, to cover what benefits as requested be in this handbook, as far as what the county or how the county or someone would continue to receive health insurance when they're on a leave of absence. So page 16, you'll see absent without leave available. That's just the standard. Page 19, workers' compensation leave is page 19 and 20.
So this is that 8 pages, right? Is that part of the 8 pages?
No, this is about
This
a
one.
page. And this comes also from the interim handbook, outlining the county's process for how they handle workers' compensation.
Is this under the FMLA heading?
No, this is just under workers' compensation, under the FMLA heading. There was already a section in the ACO one about that. Yeah.
It's under the lead, that's like the main heading. And then when it goes over different kinds of lead.
So benefits during FMLA leave is on page 32, and that was from the ACO handbook. So that has not been changed. But I think that covers the 3 areas that John asked us to cover with regards to employer payment for health insurance premium during absence.
Are you gonna make a motion there, Kiddo?
Yeah.
I'm
Questions?
just making sure what's added in your draft right here on page 16. Are you saying that did come from somewhere else and it's just moving, or is this new?
This came from what's currently in use, the interim handbook, the 2021 interim handbook.
Okay.
So
But
it's
not this most recent.
It's not verbatim, but it is all. Okay. And I tried to shorten it down a little bit, but keeping in all of the main points.
I'm just making sure, I'm not gonna go in and like grab it from somewhere and move it. I'm just gonna add this to this section.
Right, that would be what I'm proposing.
Okay. On page 16 and then on page
So 16 and then 19 and 20.
19 and 20.
And then just removing
That's not being grabbed from somewhere else either, correct? That's just adding.
Correct. It's not verbatim, but it is.
Gotcha.
And let me actually amend this on page 20. Remove from an employee must notify Oklahoma County Health and Safety. Strike copy OKCC Chief of Staff. Sorry, that was a mistake. So just amending that line. I would move to add in these sections in place of what is on page 36.
At the interim handbook.
What's in this draft that I've attached to the agenda?
Right.
For this one, yes. So yes, the information comes from the interim handbook.
Well, yeah, and I think it might be useful when you're doing the voodoo that you do, is to get with her and make sure.
Yes. Well, I try to just, also follow the minutes and because there's always a copy of the document, but there's so many.
Right.
I have so many
Right.
copies of the
I think-
handbook saved right now. It's just, I get a little wacky
If I hear
sometimes.
Aaron correctly, is like in my version, when it goes in that item 3, when it went up to that, there were some changes that you noticed that you had thought were going to be in there. Is that fair?
Yeah.
Okay. So
Yeah.
I think if you two
Yeah.
could get together.
Well, on that note, just if there's anything that anybody thinks we voted on and you don't see it, like in that clean copy even, I felt like I had combed sort of meticulously made sure those
Yeah.
things had happened. So if there's stuff I've still missed, just let me know. Be like, dude, you missed this. I'm like, oh, because I have so many versions of this on my computer and just stuff, and I think sometimes I
Yeah.
copy it into the wrong version, or I have the wrong file up. I don't know. It's
Okay.
crazy on my particular computer how many versions of this handbook I have. So if there's stuff that's not getting handled, I don't know what I've done, but because I thought I had absolutely with a fine tooth comb made sure that I'd gone through the minutes and made sure everything was
Okay.
there. So if they're not, that concerns me. So let me know what's not happening that needs to be happening.
All right.
Yeah.
You
It's fun.
do great work. None of us are perfect.
Apparently not.
It's okay. All right, there was a motion. Was there a second?
There is a second.
All right, all in favor, please say aye. Motion carries.
I'm sorry. Paul, did you pass the vote? I didn't hear you. Thank you, sir.
You said it
A
was
very exciting
enthusiasm. It's the downward spiral of eating it done. All right, we're skipping over to item 3. We're moving over to item 4. Eric.
And so item 4, and do we want to decide how we're gonna work with this? Because I was a little confused looking at it. The clean version, what came from ACO and what's going forward that we haven't discussed yet is not the same. So I don't want to spend any time talking about this or this if we're going to, I would just think we need to decide what we're working off of before we spend any time
Well,
editing either of the drafts.
the reason, we'll say it again, that I put that clean version out was to have a new starting point.
So if you look at guidelines for appropriate conduct in the draft that we were working on before today, it's now called employee conduct. And the headers are even different. It's very confusing to look at side by side. So
What page are we on?
it's 42 in my draft. It's 24 in the new draft. Called guidelines for appropriate conduct in the old draft. It's called employee conduct in this clean draft.
what we have is, I put out my version, hoping and not expecting about, that it was just, between all the red lines and all the stuff that we have going on here, that we had a new starting place. If I was wrong and assuming that that would make life easier, then shame on me. But Aaron is editing with a great deal of enthusiasm, I think. The, is it the interim or
I'm working
ACO
off of the
version?
draft that you had sent out for us to work off of
Yeah.
at the beginning of this process.
Right. Yeah.
So if
So
we're gonna
that's-
change and go a different course and not work off the ACO handbook, I think that needs to be decided before we spend any time continuing to go through the ACO book. But I would think that we should stick as closely to the ACO book and track changes if we are gonna make changes to it, so that you can discuss what's changing from what has been approved by ACO and used by other counties. Because I think sometimes, for me, something might sound better if you take it out, but there is a legal reason that it's in. So without being able to see what has changed going forward that we haven't reviewed or voted on, I wouldn't be comfortable adopting this without seeing track changes, because it is very different from the ACO version that we've been working.
Okay. Yeah. And the new chairman that this group elects next year. Go with that. I put it out there just as an example. That was my version of it, and like I said, I'm not married to it. So, why don't we go along your track of comparing it to the ACO? And you can state your case and the group can vote on it.
Okay, so then I'm on page 42 under guidelines for appropriate conduct. And I'm just proposing to simplify this list. I've made some comments on the side. I feel like a lot of the bullets are duplicated. So just to kind of condense down this list, adding a few bullets at the end.
Yeah. One of the things I think that we talked about is, like these bullets are kind of redundant. Maybe even within themselves, I'm trying to remember what, And then, we've got guidelines for appropriate conduct. And then just randomly mention two things: social media, absentee tardiness. And then we have another section called employee conduct that goes through a whole other list. This is like in the version that we're looking at here with Aaron. And so I think that was part of the sort of the condensing of all this. We've got guidelines for appropriate conduct, and then we have another big heading that's employee conduct. And so I can see that you've gotten rid of that heading, at least there on page 45, because that was kind of odd that we had basically two different sections that were purporting to be the same thing. One had the bulleted items, and then it listed a couple of things individually. And then we had this whole other section with all these individual items. So I like that second employee conduct heading is going away. And that those bullets were, some of them repeat what's already down in that longer list. And so I think that did need to happen. So I think that's helpful to make it one continuous thing there instead of broken up into seemingly two separate things, but it really wasn't two separate things.
I will say, with the start of the IT committee, which will start meeting in January, I believe. Dane Coffey had called me and said, we're gonna have changes to the handbook. And I said, but if you're IT and you have your own committee and your own policies, can we just put a link in here rather than adding two? If they come up with 25 pages of proper antique policies, are we supposed to insert that into the handbook, or can they be their own separate deal? I don't know how it's going to work. I serve on that committee. And looking forward to what they do, what they come up with. But he was saying things that are currently in our interim version handbook are out of date.
Yes.
So it'll be interesting to see how quickly they formulate a policy and what policies they put out.
And do you think some of that's gonna apply to this employee conduct?
I have no idea.
Because some of this is related to computer stuff, I think.
But let's try to push this jello across the table right now. Aaron, you want to make a motion?
I'll make a motion to approve the changes to the guidelines for appropriate conduct section.
Okay, is there a second? All in favor, please say aye.
Aye.
Any opposed? Carried. Keep going.
Okay, so take up item 5 to amend the social media policy. So I came across this statute in Title 74, and it requires state agencies and all political subdivisions of the state to adopt a social networking and social media policy. So I've taken this language from the statute and inputted it here. And I have a copy here if anybody wants to see that. I made one for the class.
So you're just taking Title 70 and just dropping it.
And then it's Title 74, Section 840-8.1.
Is that language exactly?
I mean, it doesn't copy and paste the statute, but it does copy and paste like the requirements set forth in the statute. So like the bulleted list 1 through 4 comes directly from the statute. Changes say Oklahoma County employees instead of just being like so broad, but all the substance comes from the statute.
You go back up, Cassie.
Yes, sir.
Thank you.
The only reason I was asking that is because can we just use that top line only that way in case something changes? We don't have to come back and amend the handbook for that part. It would just. Or is it linked
The
to
only reason I say no is because you have to, this requires us to distribute it. So distribute to each affected employee by email. So I mean, maybe, but I think it's cleaner to.
Seemed like to me, once you send the handbook and you sign off on it, it's pretty clear, right? But you said it could be distributed via email.
That is what the statute says.
All right. You got a motion?
Yes, I would move to accept the change or the changes to the social media policy section.
Okay. And just realize that IT may come back with everything.
Sure.
Okay. Is there a second?
Second.
All right. All in favor, please say aye. Aye. Motion carried. Any opposed, by the way? No opposed? No opposition. Item 6.
Okay, so item 6 is just clean up and
I'm sorry, I'm not trying to make y'all busy.
so yeah, just clean up and take out some words, keeping the same
So what we're seeing up there are your changes.
It's on page 45.
Okay. Want to make a motion?
I would move to approve the changes in absenteeism / tardiness.
Is there a second? Second. All in favor, please say aye. Any opposed? Motion carries. Item 7.
Item 7 is just to remove that employee conduct header that Leanne was talking about. It's kind of random.
Make a motion.
I'll move to remove that employee
Is there a second?
Second.
All in favor, please say aye.
Aye.
Motion carries. Item 8.
item in the personal appearance and demeanor section, just adding or BOCC department head. Right now it says each elected official BOCC. And that's all. So I'll move to accept that change.
Is there a second?
Second.
All in favor, please say aye. Motion carries. Thank you, Aaron. Item 9.
Okay, item 9 is just minor cleanup to the political activity section, not changing any substance. And I'll move to accept the changes. It's on page 46.
Second.
Second.
All right. All in favor, please say aye. Okay. On a roll.
Did I get in that? Did I hear it? Oh, sorry.
Motion
I'm
carries.
trying to be sure it was.
Aaron, you should go out to Vegas. You're on a heater. What do we call a heater in Vegas? Item 10.
Okay, item 10. Just recommending to make this second. So the header county property includes, and then what follows, just make it all one paragraph, just save us those 2 lines. And then removing for county purposes at the end.
Okay.
And I'll move to accept those changes.
Is there a second? Second. All in favor, say aye.
Aye.
Motion carries. Item 11.
Okay, so item 11 on page 47. I just added in social media and social networking platforms to communication systems for the definitions. And also including use of communication systems.
Taking away pagers?
Taking off pagers, unless anybody uses one now.
They're gone.
Hey, Paul,
Maybe on Tuesdays.
Okay. You got a motion there?
Yep, I'll move to accept those changes.
Please. Is there a second?
Second.
All right. Any discussion? All in favor, please say aye. Motion carries. Item 12. Final agenda.
Okay, so item 12, I'm not proposing any action. I'm just asking for some discussion about mobile phone policy, the vehicle usage section, and the uniform and safety equipment. So reading these and looking at the Oklahoma State Constitution and the IRS rules that are in here, I wasn't seeing anything about mobile phones in the Oklahoma Constitution, nor vehicles, nor uniforms. So I'm not really sure where that came from, but really wanted to ask Lisa's opinion on this and just kind of get everybody's thoughts, I guess. Yeah. And one of the things in here, started mobile phones. It's basically saying if you have a work phone but you use it for any personal calls, you have to claim it on your taxes. And then same with the vehicles, like it's a benefit, has to be included on taxes.
Okay, the Constitution, it doesn't specifically mention cell phones, but any use of county property is, for personal use is prohibited. So they've just created, this is the ALCO version, assuming, right?
Mm-hmm, yeah.
Like I said, that language where the specific question is, yes, mobile phones did not exist in 1906 when they wrote the Constitution, but it means any, it's how ACO's attorneys did it. It's any property that's specific to mobile phone.
So what does that look like if somebody receives a stipend for a personal phone?
If you receive a stipend for the personal phone, then that's not county property, that's your property that you are giving a stipend to use for county, just the same as you would if you were to drive your own car for county purposes and turn in, that's not county property.
It's like, if
Your tax.
I was gonna say, it should be like box 12 something, when you guys send out the, W4, W2s at the end of the year. It's under like box 12A, 12B, 12DD or whatever. You should have all those things generated from you guys' office.
Is that practice though?
If it's a
I don't know, I work
stipend,
in the county, but I'm just saying this.
because it's broken out in our paycheck. Yeah.
It's broken out
What
specific.
about for vehicles? Are those included as a tax benefit on W-2s?
It is if you use your own vehicle.
Use your own vehicle?
Yes, there are some employees that use their own vehicle to get that stipend.
And it's reportable.
Yeah, the only time a vehicle, the only thing I think the time a vehicle would be, will pass on your private taxes if you used it for personal reasons. Like a deputy, for example, is not gonna be paying taxes on a county vehicle because they can't stop somebody from a personal truck. Guess they could. On the W-2, there should be specific codes for all that.
Another question I had is under uniforms and safety equipment. This says it's considered a taxable fringe benefit.
Uniforms,
Mm-hmm. And safety equipment. And it also
they
says,
should wear it to church.
yeah, and I just don't think it's practical.
Yeah, right, yeah,
That's being done, so,
yeah. I mean, maybe if the county gave you a clothing stipend, like you're required to wear suits or something, the uniform seems odd. I mean, again, I don't know how you.
Well, that might also come back to ownership. Districts, they lease those, and it doesn't belong to the employee. They leave it there to be laundered and returned, and so it's not owned by that individual. So when that individual leaves employment, they surrender those uniforms. So, and it's the same thing. You know,
Right,
deputy.
right.
So I don't think it's not.
It may
They
not-
don't own it.
They don't own it. Now, there might be some counties, and like I said, there may be some counties that require their officers to purchase, and same thing with county employees, they get a stipend for you know, districts, they give them a stipend for jeans or work boots
That's different.
or maybe non-county, and they would own that, but they get a stipend for clothing because they're, so that.
The sheriff can appoint those reserve deputies, don't they have to pay for their own?
Them on their own.
They buy their own.
So it's not a county benefit, it's not.
Yeah, and Aaron, I think, I mean, and I've never gotten a stipend, like, other than maybe like a safety stipend, but I think on that left-hand side, I think it's all itemized out there. So I would assume that Munis at the end of the year for those people does differentiate those numbers and again, those categories. I think there's like 12A through like DD, and then there's like 13 through something where it specifically outlines, you know, like for example, like the life insurance over 50,000, like that's got to be reported to the taxes, so that's like a separate line item. And I would assume the phone stipends are, but assume that everything else is. But again, I don't receive any of that stuff. Life over 50, so I don't know. And then, of course, like, same thing like with the employer's portion of your healthcare. That's one of those specific, I think that's like, again, like code 12B or something, where, so all that gets inputted in your tax due. I think it's all, I would assume that Munis is set up to do that, but probably a pretty big assumption. But,
Should.
yeah, we probably, I mean, I guess we could do that. Yeah, I'm kind of unclear on what all taxable, what's not. I mean, I wouldn't think the county phones would be, but stipends make sense. That would be, I mean, for phone stipends
Which I
specifically.
think the stipends would, because they come through on your paycheck, I think that those probably would be included, but not. So this says the county will periodically audit the usage of county-owned vehicles to ensure the valuation of the amount of the taxable fringe benefit is appropriate. Like some of those things, I just don't think we should jump into like putting them in a handbook.
Yeah.
If they're really just cookie cutter from ACO and it's not, like it doesn't make sense. So.
Or is there a scenario, again, in the county where, I mean, somebody benefits personally from a vehicle, like the commissioners, for example, get vehicles that they could drive to Walmart, I don't know.
They get a stipend.
Okay.
Which would be taxable.
Yeah.
There are employees with assigned vehicles.
Yeah.
But
The
they're not.
maintenance guys could be in a vehicle that they have to drive home and drive 24/7, because they can be called out 24/7 on a road incident. At least that's how it was at ODOT. So that provision did apply, because they would periodically see how much personal mileage versus work mileage.
Yeah. Well, I'm sure my department's the biggest, user of that, of those vehicles that are signed in permanently. Again, it's,
So does it just need to say that they won't use it for personal use to avoid it being a taxable fringe benefit?
I'm not gonna comment today on a tax code issue without looking at it.
Yeah, that makes sense.
That's November,
Yeah.
I mean, like I said, I only comment that it was in there, it's the standard. You can deviate from it, but, the old version of the handbook probably didn't even address it.
I mean, again, I would think, so if somebody's assigned a vehicle that you drive home, it's, I guess, the commute, the taxable part, or because you're not pouring their own gas into it. I have no idea.
I don't know, I know the public defender, gas is up their cart District 3. And does it come out of a budget? I mean, you guys send them a bill and it's paid, so it's not Miss Bethel is not benefiting from that.
Well, I mean,
But you could say if you drive it home and you drive it to work.
you're not.
Well, like our road superintendent, he can be called out at any time, so he takes his county vehicle home every day.
So
Our deputy.
that would be for
And
county.
he probably drives
purposes.
it to church too, because he could
Well,
get called out in the middle of church.
He just has to separate the mileage.
Right.
What's business?
And that's what that's trying to tell people that they have to do. That you're gonna be taxed on your money.
And they are?
No.
Yeah.
Deputies are, at least. Well,
More questions, Aaron?
I mean,
If
we
you
feel
want
like we-
further research into that, you'll
Or
want
you want to defer it?
to defer it and.
Yeah.
what specific things are we trying to, so we're deferring it, but what specific things we need to get answered? Are you specifically talking about the work vehicle and how it should be taxed for personal use, or do you mean the mobile phone thing, or just all three of them?
All three of them. I think just some clarification about what's required of us, what's the current practice. If
The
it's
county's just
not-
like any other business owner when it comes to a vehicle. So if the vehicle's being used for business purposes, that mileage that's used for business purposes is a deduction of their taxes.
But this is talking about county owned vehicles.
Say that again. So if people are.
So if I'm a business owner and I own a vehicle,
Uh-huh.
okay, and I could be using my personal vehicle for business purposes, it doesn't matter. I track my business miles, I track my personal miles. The business miles are right on. The personal miles are not.
I do that with my photography.
Yeah.
Photography.
I just don't know how far you get the weeds on this still. I mean, safety equipment. I mean, if a district yard worker drives home a vehicle, they've got straps, and they just walk grandma's couch and they use those straps. I mean, I don't know how far you.
Once again, is this a reporting requirement of the employee? This is the handbook, so we telling the employee it is up to them on their personal taxes to follow the tax code, and that's probably what we need to keep reminding you. Is this a requirement on us to do something tax-wise? We need to be looking at that. If this is just, hey, if you're using company vehicle for personal use, you might have to report that on and pay some taxes on it. That's, an employee would need to know that, and that needs to be that, but I don't know what the hang up on the language is. It's just because we don't think we need it,
No, I'm asking.
like what it really means.
Mm-hmm. And if it should all be included. Like another example on the uniforms and safety equipment, it says uniforms and safety equipment will be provided only to employees in a position where the written formal job description for that position includes the issuance of county provided uniforms and or safety equipment as part of the compensation package. And I know a lot of departments will give out uniforms. And you've got that on right now. I have uniforms, but I don't think that my job description says that I have uniforms.
What counts as a uniform? Anything that's got a county logo on it, or is it something you're required to wear? I don't even know what the definition for sure of uniform is.
Yeah, it is defined in this section.
Here's what I'd like for us all to go
You got donuts.
separately when we got done that. Can we defer this to the next meeting? And we'll try to get it cleared up.
Sure.
Because we could debate this stuff.
So what's your motion to defer it to next?
Is there a second? Okay, all in favor, say aye. Thank you all. I look forward to having
Motion to adjourn.
is there a motion to adjourn? Right there, is there a second? All in favor?
Aye.
Aye. Help yourself to donut.
Make a motion to reelect Rick.
No.
Donut.